Hi friends, I'm Dr. Tejashri and today I'm going to talk about low AMH. AMH or anti-Mullerian hormone is something I've been talking about in my videos, and I feel that any girl who's trying to get pregnant and hasn't achieved pregnancy after trying for 3 months should have an AMH test done so that she knows how many eggs are remaining in her ovary. Now, AMH is not a test for quality of the eggs. However, we do see that as the AMH goes down, the quality of the eggs also goes down, in the sense that the eggs have more chromosomal errors, resulting in more abnormal children, more rate of miscarriages and negative pregnancy results. So, of course, what we understand is that as the AMH goes down, the chances of getting pregnant go down, right? But how low is low? Now, normally we have a decreased ovarian range definition which says that AMH between 0.5 nanogram per ml to 1.26 nanogram per ml is decreased ovarian reserve. That means this is the second last batch of eggs which is coming out, and if the AMH level is less than 0.5 nanogram per ml, that means this is the absolute last batch of eggs which is coming out. Now, many people come to me and we are trying to get women pregnant even with a very low AMH. The lowest AMH at which I have achieved a pregnancy is 0.27 nanogram per ml. However, I need to give you a word of caution here. Many people, they come and they start trying with me, and then they are in a happy state, and then suddenly a situation comes when we do a stimulation. We take the patient into the operation theatre for collecting the eggs, and we find that the eggs are empty and we are not able to collect any eggs at all. Or a situation can happen where we are able to collect the egg but it is not fertilized. And also sometimes the fertilized egg will be growing but it gets arrested before it reaches the blastocyst stage. Now, all these cases are patients with low AMH where they feel that the whole cycle which they have done is gone down the drain, all their effort has been wasted, and then they go into kind of depression. But it's not correct, because see, we need to understand that our bodies are not tuned to be the same each month, all right? And especially if the patient is having low AMH, then the chances of getting a pregnancy are very slim. So we are really trying against nature, very strongly, not trying to get the patient pregnant, and we are trying to make her pregnant. So the first thing I would tell the patients with low AMH is be very strong and be patient. Okay, so it's not like that if in one cycle we are not able to collect the eggs, or the egg doesn't fertilize, or there is no embryo formation, that doesn't mean it's not the end of the world. Sometimes you may have first 2 cycles very good results, you may bank embryos, and in the 3rd cycle we may not get any eggs, right? So this is our body. So we need to understand that bodies can vary in response in different cycles. So that's why for patients with low AMH, we generally give embryo banking cycles. We don't rely on just one cycle. We do 3 egg collections. 3 times we put the sperm inside the egg, make the embryos, and then bank the embryos. And at the end of the 3 cycles, we do PGT-A, that is a genetic testing. And then once we have a normal embryo, then we do the frozen embryo transfer. Generally at this AMH, it is said that we need around 5 to 6 embryos to get one normal embryo. So my first word of caution for women with low AMH would be that if you are really trying to jump into IVF to do the 3 banking cycles with the PGT-A, then you need to be very, very strong and very, very patient. You need to understand